because your body has a thing called cellular memory. Cellular memory remembers what you used to look like. And if you lose focus, you're going to go back. But if you connect an emotion, the cellular memory changes. Cellular memory changes.
Isn't the body so intricate?
It is.
I
It
mean,
is
our
unbelievable.
cells have a memory?
Oh, yeah. Oh, yeah. I had a doctor tell me that
Good
they
Lord.
take fat cells from one area and put it into another area, and when that person gains weight, they gain weight in the area where the fat cells were put in. Interesting. Okay. Okay, I'm gonna ask you a question. I want you to describe what does excess weight feel like to you, look like to you, or sound like to you, because everybody's gonna have a predominant thing. So when you're thinking of yourself as being overweight, is it something you look at, you feel, or you do have a sound, like you go on the mirror and go, oh, I mean, is there a sound there? And that's your telling your body, oh, God, I'm fat. See, there's a sound, and your body is hearing that all the time. Or what you feel like. I feel like 10 pounds of sand in a 5-pound bag. I am not I'm not gonna buy another size bigger pants. So you suck it in and get in there, and then you're walking around like this. This is what you feel like. You're cramped, you're stuffed. The other thing would be, what do you look like? You look like an elephant to yourself? These are things that you are doing individually that you don't really realize. You're seeing, you're sounding, you're looking, feeling, all these different fat things. So one of the things I tell my patients, I'll say, when you're not out and about, I want you to go buy a pair of pants that's too big for you and wear them around the house.
Too big?
Too big. Because I want you to feel what it's like to lose weight. See, you don't feel it because you always got stuff that's so tight because you're not going to buy a bigger size. And so what does it feel like to lose weight? Well, I walk around in like gym pants or something that's real baggy and just go, God, I lost so much weight. Look at this. You're psyching yourself out. You've got to do stuff. You've got to do stuff to reprogram your mind. You've got to reprogram. And I can't stress enough about emotions, because when your emotions are involved, it is the strongest force you have. It is your biggest weapon. Your biggest weapon is your emotions. Because think about it, why do people eat a lot of times?
Emotional eating, comfort.
That's right.
Oh,
That's
I'm
right.
gonna feel better if I
It
dig
makes
out.
you feel better. That's right. So you gotta use that tool and incorporate it in a different way. Okay, I have a word for excess weight. It's called armor. When your body is stressed out, it's in the fight or flight mode. If you're gonna fight somebody, what are you gonna do? You're gonna put up your armor, right? That's what it is. It's armor. Really, if you think about it, it's just armor. I'll take the armor off. And if you're constantly under stress, you're just adding more armor and more armor and more armor, because that's what your body does. And it does it through various different hormones and enzymes that are upregulated when you're stressed. And it just keeps adding it on. So let's just look at a couple of things that can cause stress. Anything within the scope of the 5 senses, okay? Our senses were built for us to keep a watch of our external environment, to tell the internal environment what's going on. Because the cells inside can't see if there's something that's going to happen that will hurt us. So our eyes detect danger, our hands feel, they detect danger, our taste buds detect danger. So if there's no danger, everything's cool, right? Everything's fine. We're all of a sudden you touch something hot. Whoa, how did you react that fast? That was how the brain works, extremely fast, extremely fast. And so as our senses are telling us these things, our body is reacting inside. And many times the brain makes these, and it's going through the subconscious level. Well, it could be conscious too. You know, all of a sudden you smell smoke. Oh, I think there's a fire, I better get out of here. You know, that alerts you. But subconsciously, you know, I can touch this right here and my body's saying, yeah, this is fine. But if there was a temperature change, if it was too hot for me or rough, or if it was pointed where it was gonna cut me, or my body has learned that it's gonna cause stress. So it turns on that fight or flight mechanism, and that's how you react so quickly, is that fight or flight mechanism, which God gave us to be so quick to save our lives. But many times, the brain, through the subconscious, will make the association that something that normally is good for us, or something that wouldn't hurt us, is gonna hurt us. For instance, you get things like food allergies, or you're allergic to pollen and trees. Trees aren't gonna hurt you. Why are you creating these inflammatory proteins to the trees? You know, they're not hurting you. And there's reasons for that, which I'm not gonna go into, but your brain starts to form these associations many times, and if they're not taken care of, they just keep compounding. Now, this is putting chronic stress on the body over time. Stress, 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 stress. Inflammation will interfere with a lot of the processes that have to do with losing weight. One of them is it interferes with the uptake of your thyroid hormone. So you will have low thyroid symptoms. You go to the doctor, he'll test your thyroid, oh, thyroid's good, but you got all these symptoms. Well, your thyroid's good. It's all, you know, so they don't do anything. So you have what's called secondary thyroid problem, not a primary. So your thyroid's okay, it's just at the receptor site, you've had so much inflammation going on in your body, and if you're diabetic, you've got a lot of inflammation too. So anything that's causing inflammation in your body will slow down your metabolism by way of thyroid hormone. Okay, and there's ways to reverse this stuff too, so. Then there's internal environment stress. So that was all external. Internal. You have an injury, you know, you get in an accident. Is that gonna stress your body out? Well, yeah. How about bad bacteria in your intestinal tract?
Mm-hmm.
Yes, because you're not digesting your food, and you know, you get gas and bloating, and that's not normal. You know, things like viruses and yeast and parasites, you know, they're taking over your system. Now, we all have a little bit of this going on in our system, but our immune system should be normal enough to take care of it. But when we've got so many other things going on, sometimes some of this stuff gets pushed back on the burner, and these infections just keep compounding, and it's causing more and more and more stress on the body. So another thing would be chemicals and toxins, and you saw the cleansing chart that I gave you, that these chemicals and toxins are causing stress on the body, so the body just, I don't know, this is the fat cell. I can't handle this. So then your fat cells get more concentrated because there's too much toxins in there, so you just keep. Some people, they're just like, I'm not doing anything and I'm gaining weight. Well, could it be that? I mean, that could be one reason. It's something to think about. Wore out parts such as your joints, hips, knees. You know what amazed me is I'm seeing people in their 40s needing hip replacements. What the? Why? I mean, they're not marathon runners either. But I'm seeing this more and more now, that their body is just wearing out. And usually it's through poor nutrition or absorption or something. And so this is going to put a strain internally on the body. If you're in constant pain, you're putting a strain on the body. You're turning on the sympathetic nervous system, your fight or flight site. Now, sometimes you can't help it. You've been in an accident, you got neck pain, you got back pain. You do the best you can. You know, try to take as many anti-inflammatories that you can to reduce the inflammation while it heals. Any kind of infections that you might have, or stones like gallbladder stones or kidney stones or stuff like that. Big stress on the body, huge. How about a malfunctioning organ? Thyroid malfunctioning, liver malfunctioning, kidneys malfunctioning. Oh my gosh, we're breaking down here, nothing's working, body's stressed out. Now, you put a lot of these together, and you've got multiple things that are all the time, chronically, stressing the body out, keeping you in the fight or flight side of the nervous system being activated for too long a time, brings you into a breakdown mode. Your body's breaking down. Actually, I'll tell you, stress is the one factor that will kill us. It causes every disease known to man is stress. And it is the basis of weight gain, is stress. So what is stressing you? There's something stressing you, something. Nutritional deficiencies is another thing. If your body doesn't have the building blocks, it'll stress it out. It's like, oh my God, we don't have enough calcium, what are we gonna do? So it'll go looking for things. If you don't have, for instance, if you don't have enough calcium in the blood, okay, and you've gotta have, because it regulates your pH. So your pH can't move in the blood. If it moves just a little bit, it's okay, but if it moves too much, you're gone, you're a goner. So it'll say, okay, we need something, we need some calcium. Where can we find, who's got a big bank account of calcium? Bones does. Okay, let's go rob it. Let's go rob the bank. So it does, it starts to rob the bank, then your bones start to decrease. And this is another reason why hip replacements or knee replacements also can be because of bone and ligament degeneration, because of nutritional deficiencies. Now you can get nutritional deficiencies from not only not eating food, eating the wrong kind of food, or not being able to digest the food or assimilate the food. So there's a lot of processes that have to go on. We just don't even think of these things, really. If you don't chew your food, you don't get any benefit out of it? You will not get any benefit if you do not chew your food. And if you can identify what's coming out in the toilet, you're in big trouble, because you should not be able to identify your food. There's a lot of people like, oh, I had corn. How do you know? I saw it in the toilet. Well, did you chew it? Well, of course I chewed it. I said, well, what, did it come back together? Come on, you didn't chew it. And I'm doing colonics and I'm seeing broccoli come through, and tomatoes and I'm like, where's your poop? It's like nothing there. There's food. No, you have not chewed your food. You got nothing out of that. Nothing.
Well, what about when you make smoothies? You're making like green smoothies.
Well, that's being all ground up for you, but you
Right.
should keep it in your mouth a little bit, because the enzymes that come out of your mouth are actually gonna start to digest the sugars and the starches and the carbohydrates and stuff. And you need that enzyme that's in your mouth. So if you swallow it right away, you won't get as much benefit. So you let your saliva kind of, move around into it a little bit. But yeah, it's broken down for you. Okay, now we're gonna dive into imaginary stress. Does anybody have imaginary stress? People are always stressed out over something. It seems like. They have no sense of time. They have no sense of time. Their body, or their mind, flip-flops from the past to the future, from the past, and we all do this a little bit, but some people do it all the time, and they're never in the present. They're in the past or in the future. You probably know people like this. And I'll tell you, if a person is depressed, they're living in the past. They're living in all the negative past. That's what depression is, basically. If you have anxiety, you're living in the future. And you're thinking of all the things that are gonna go wrong. And you're freaking out about it. That's all that is, basically. So, as we're looking at imaginary stress, some people, have to have everything perfect, or that stresses them out inside. I've had a lot of students come in and they want to be A students. I mean, that's a good thing, but it gets to the point where it's obsessive with them. Or you can be obsessive with anything, and that will stress you out. You have to remember, you've got to activate the other side of the nervous system. And so when you start seeing things that are going to stress you out, you activate the other side of the nervous system and start thinking of all the positive, wonderful things, like a vacation you had in Hawaii or something, something that made you feel good, that bring up that feel-good feeling again, because it's all about the brain. It has nothing to do with what you eat. Because once your brain is activated properly, you're going to eat properly. And you're going to make the right decisions, and you're going to feel good, and you're going to be happy, and you're going to enjoy life. And your passions are going to come back, and then your metabolism's going to go up. And I'll tell you, passions is the biggest thing I can think of. You've got to activate your passions. And, I ask people and say, well, what do you like to do? I like to paint. Well, do you paint? Well, no. Well, why don't you start painting?
Yes.
Things
Something
that
that makes
you
you
love
happy.
to do. What is your passion? This is going to raise your metabolism. Being in love is the highest passion. And you should be in love with yourself. Seriously. You should be in love with yourself. Okay. Here's one secret that nobody ever talks about. Boy, am I giving you a lot of secrets, aren't I? Okay, this is one that nobody talks about. Your thoughts, what you think about every day, every minute of the day. And you can't tell me you don't talk to yourself in there, because I know you do. What your thoughts are, or your experiences, or I should say put them together. Your experience of all the things that you've experienced in your life, in your thoughts, actually create your external picture. And that's true. Because I can think of the way I was raised and experiences that I've had in my past. And I always thought I was ugly. Now, I'm not Gorgeous George, but I always thought I was ugly. And when I wrote the book, The Flip-Flop Effect, I had to go get a professional picture made. And I'm looking at these, like the Enquirer magazine, you see these movie stars without makeup on and they go, oh my God, they're ugly. And you see them on the red carpet and you're just like, oh yeah, I could never be like that. Are you kidding me? It's all made up. I said, I can do that. So I did. I put false eyelashes on, 6 inches of makeup, I did my hair, and I went and had my picture taken at Walmart. And I was shocked. I saw myself for the first time through the eyes of what other people see me. And I had no idea. I had no idea. And it just changed it changed the way I walked, it changed the way I talked, it changed my confidence. And that's one thing that I wish I could do. I wish I could take pictures of people before and after weight loss. And their after weight loss picture would be with their hair done, their makeup, clothing, nice clothing on, and have a really nice picture done, because I guarantee you, man, there's nothing like it. The way you see yourself is going to be, it's a big thing. So just because you're heavy, don't be sloppy. That's what I say. Don't be sloppy. You do your hair. Go to a hairdresser. Go to the barber. Go wherever, and look good. Buy clothes that look good on you. You can go to some stores and they've got helpers like Dress Barn, I like that store. They have, they'll have the girls that'll say, that looks pretty good on you, or I don't like that color, or, because there's colors that look better on you. There's, everybody's shape is different. So buy clothes that you feel good in, that you look good in, and take pictures of yourself. So if you're heavy right now, it's okay. It's okay. Because you've got to start somewhere. You've got to start up here, and you've got to start reprogramming. You love yourself. You love yourself. Remember that. Because inside is not who you're seeing on the outside, right? I mean, you're like a person in here.
Right.
But what you're seeing out there is not who you are inside. So make that inside person come out. So emotions, again, I just want to reiterate on that. If you were to break this down, emotions are energy. Think of energy in motion. That's what your emotions are, because your emotions make you act. They create the energy for you to act. You need positive emotions because they're going to put you in a positive, higher place. And when you're in a higher place, you're going to be more confident. And what this does is raise your metabolism. See, it's not all exercise. It's not all well, there is exercise. Exercise is up here. This is where it's got to start. It's got to start up here. You can go on the fad diets. You can exercise. I'm not saying not to, because you do need to do that. But what I'm saying is, if you're exercising or you're on a certain diet, it's not going to work for very long until you've reprogrammed this, because you remember cellular memory. So we have to retrain the programming that's going on inside here. Your self-talk. How are you talking to yourself?
Yeah.
Does anybody ever talk to themselves? I do all the time. Mostly in the shower, I talk to myself. But you know what comes out of my mouth? all of a sudden, I remember one time, I was thinking about something, and I was trying to figure out why this was happening. And I was doing this, the back and forth thing. I was doing this. And then it was a person was involved. And so finally, I just said, "Oh, give me a break," like that. Well, sure. And I never realized how many times in a day I said, "Give me a break." I started thinking about it. God, I say that all the time. You know what happened a few days later?
You got a break.
I broke my arm.
Oh, no.
Your body just, things happen to you. It's like the law of attraction. You keep saying, "Give me a break, give me a break." Okay, I'm going to give you a break, finally. You break your arm. But it does happen. It does happen. And because your mind is so powerful, you start to absorb things into your life. And things happen.
Well,
So you got to
can I share
reprogram.
one little teeny?
Sure, yeah.
In the Bible, it says, God says that we get the fruit of our lips, so what we speak out, actually, and it's a law.
It is a law.
And so if we start speaking out good affirmations about ourselves, like, I love myself, I'm worthy of feeling better and being in good health, I like to exercise, I like to have healthy choices in my foods. If we start telling ourselves good things, then we're gonna start doing what we're saying.
That's right. That's the law of attraction. That's the law of attraction. I'm sure, I don't care how bad you hate yourself, I'm sure there's one thing that you like about yourself. One thing. So when you look in the mirror, people are always like, "Oh God, my face," because, that's what everybody looks at is your face. "Oh, my face." What is one thing on your face that you like? One thing. You focus on that one thing. I don't care if it's an earlobe. "Oh, I really like the way my earlobes are. They're so cool." One thing. Your nose, your eyes, your lips, your cheeks, your chin, your forehead. I don't care what it is. Focus on that one thing and always say, "God, you've got beautiful earlobes," or "Your lips are pretty," or whatever. Focus on that one thing. So everybody's got one thing, at least one thing that they like about themselves. Focus on that. That's going to start your reprogramming for the day. And every day when you look in the mirror, you say how pretty that one thing is. Okay, so your body runs along on what's called normal, your normal metabolism. Chronic stress changes your normal. Your normal, which your metabolism was up here, your new normal is down here. Metabolism dropped because of stress. Chronic stress, long-term stress is changing your normal. So we have to change that. Get rid of the stress. And we talked about a lot of different things. Reprogramming. So just to go through and review some of the things here, if you haven't been checking off here. Too many calories or not enough. This is something that, are you eating too much? Or do you not eat enough? Because I've had people say, "I can't lose weight. What are you eating?" "Well, I only eat one meal a day." Well, that's why. You need to eat to keep your metabolism up, because it takes a lot of calories to burn up food. But there's this point, see, there's the flip-flop effect here. You eat too much food, and your metabolism gets bogged down. So there's always this balance that's going on. Eating too much food or not eating enough food. Okay, not enough calories or eating enough. I just said that one. Okay, burning calories efficiently. You got to exercise, because if you don't, your metabolism's going to go down. That's one of the best ways to burn calories. You can't just sit in a chair and say, "Okay, burn calories." Well, you could if you're in a sauna. But still, your heart's, in sauna you're sweating, your heart's moving, and so on.
So does exercise increase your metabolism?
Yep. Mm-hmm. Your biggest muscles, anyone know where your biggest muscle is in your body? It's not your mouth. What? Yep, right here. This is your biggest muscle. So when you're moving this muscle, you're burning the most amount of calories. So if you're sitting on the couch, move that muscle. Go like this. Do something. Keep moving. Just keep moving, because when you stop moving, you become stagnant. And stagnation is where all disease begins. Stagnation. Wrong ratio of carbs to protein. So when we're looking at the food that we're eating, if we're eating too many carbs, raising our insulin, and not enough protein. We need to eat more protein because protein will still build energy out of protein, but it'll do it at a more efficient rate. You need carbs. So I don't believe in the no carb diet like the Atkins thing, because these people all got fat afterwards. They went back eating and their body like, I don't know what to do with these carbs, we'll just store it. So you've got to have carbs. Your brain uses a tremendous amount of carbohydrates, tremendous. So another thing, use your brain more. You're going to start in a positive way, of course. Start losing weight. So you should have, a good amount of protein, like 60% should be protein, high protein foods when you're trying to lose weight. 30% fat, and by the way, fat does not give you fat, okay? Get that through your head. Fat does not make you fat. And about 10% carbs. That's a good ratio for starting to, trying to lose weight. If you eat the wrong type of carbs, this is what happens. And when I say the wrong type of carbs, so let's say we're going to drink some apple juice. It's carbohydrates, sugars, and apple juice, right? Versus eating an apple. What happens when you drink the apple juice, or the candy bar, or the donut, or whatever? What's missing in there is the fiber. And fiber is your biggest friend. If you can get 35 grams of fiber in your diet a day, you will lose weight. 35 grams. And you can do it through food, but if you don't, then you should take some supplements. But you'll start to lose weight. And then here's the reason why, especially with a meal, or just before a meal. When you eat food, if it's devoid of fiber, then it goes directly into the bloodstream, which is going to put too much sugar in your bloodstream, which is going to it causes your cortisol to go up, activating your fight or flight system. And then what goes up? Insulin, to drop it back down again. And we don't want this. So if you eat an apple versus apple juice, there's tons of fiber in there. Fiber's a sponge, and it just sucks up the sugar. And you know what? If you need, say you're not that active that day, or you are active, if you need the sugar, it'll release it a little at a time. So instead of a spike in blood sugar, it'll just slowly go up, and then it'll slowly go down. So it's not this going on. This is what's killing people. It's this up and down spiky thing going on with the insulin. And so the sugar just goes out with fiber, baby with bathwater, right? The other thing that fiber does is it is a broom. It cleans the intestinal tract, gets rid of all that crud in there. So fiber's your friend. You need lots of fiber, lots and lots of fiber. Fruits and vegetables. Predominantly vegetables when you're trying to lose weight, because there is going to be less sugar in vegetables versus fruits. So try to make predominantly your meal using a lot of vegetables. Not that you can't use fruits, but just make them more less predominant. Another thing for weight gain is poor nutrition. Poor food choices. If you don't have the nutrition, and I'm talking vitamins, minerals, that kind of thing, what is your body going to break up the fat with? It's got to have these things to break up the fat. And if you're eating food from McDonald's all the time that has nothing in it, which I would have brought my hamburger over here that I bought 3 years ago, it's still sitting on my smoothie bar. Has anybody seen that thing? It's like petrified by now.
Are you serious?
Yeah, it never rotted. Never rotted. And I said, this
meat
is
is
not
horrible.
food. That's not food. So when you're eating stuff like that all the time, that has no nutrition in it. All you're doing is putting sugar in your body so it can keep running. That's it. But eventually it's going to break down. It will break down. It's not if, it's when. Because you're not putting the right food in there to keep it going. Digestion is important. If you don't digest the food in the stomach, you're not going to get your nutrition. If you don't assimilate it in the intestinal tract, you're not going to get your nutrition. So, people with certain diseases have malnourished things going on. Acid-reducing drugs is probably one of the worst things you could take for nutrition, because it blocks the enzymes that break down your food in your stomach. And I understand if somebody does have an ulcer to do it for a short time, That's okay because you're trying to heal something, but long-term, these things are killers. These drugs are killers. You want to get off of them. Medications, all they do basically is reduce the stress in one area and create stress in another area. That's all they do. But if you need them, you need them. So I'm not knocking them 100%. I'm just saying, don't make it the first thing that you do. Make it the last thing you do. Antidepressants and pain meds are probably one of the biggest things that interfere with thyroid uptake, so that you're not going to be able to lose weight if you're on these things. So you need to start weaning off. Find out what you can do to get off of these things. And there's many ways that we can help you. We've got programs that can help you reprogram your brain. And this is what you want to, I mean, all of us, you know, we all have some negative programming from the past, but if it's so detrimental that it's interfering with your life, weight loss, or any other kind of disease process that you have going on, you need to get that reprogrammed. And we've got programs that we can put you in to help reprogram that brain of yours. Your thyroid is your gas pedal in your car. So you think of your gas pedal. If your gas pedal's really depressed down, your car's flying. You're a hyper person. If your gas pedal's way up, your car's just barely idling down the road. You're hypo. Again, all in balance. And your thyroid and your pituitary are set in motion to feed back one another, to tell each other how fast or how slow your metabolism should be. So pituitary in your head has a big part to play. But you know what happens to pituitary when under stress? It bottoms out, it gets tired, it don't work. So it can't send the signal to your thyroid to do what it needs to do. Or it can't send the signal down to your liver to detox, or it can't, because it's too tired. It's too tired. So we have adrenal glands, we have the thyroid, and we have the immune system. They are the trio buddies that are going to keep you alive. One of the things that Pat said last week was your immune system in your gut, which is about 75% of your immune system is down here, is responsible for heart disease. I thought that was interesting. It's also responsible for diabetes. It's one of the things. So gut bacteria is huge. It's huge. If there was a fire in my house, and I got probably as many supplements in that store as I do in my pantry, and I could take one bottle out, just one bottle, it would be a probiotic. Because that's the one thing that's going to make the biggest bang for your buck as far as nutrition, because it does so many different things. It's unbelievable. Matter of fact, when our bacteria goes down, we go down. That's it. We're done. It keeps us alive. Keeps us alive.
Can I ask a quick
Sure.
question? What do you think of kefir?
Kefir?